I developed post-traumatic stress disorder from getting laser eye surgery. I've experienced quite a few traumatic events in my life, but nothing as near as traumatic as getting laser eye surgery. And this was so traumatic an event that it actually caused me to develop PTSD. I looked up the definition of PTSD, the symptoms associated with it, and how it's treated. So these are some things I'll read to you right now. And as I'm reading it, I will go back and relate my own experiences. So the definition of post-traumatic stress disorder is that it's a mental health condition that can occur after an individual experiences or witnesses a traumatic event. This can include events such as combat, natural disasters, serious accidents, or personal assaults. How it relates to me is I would consider what happened to me as a personal assault. I believe I was assaulted by these ophthalmologists, and I even had my optometrist basically say it kind of a graphic way, but that they actually raped me of my vision. And I do believe that's actually what they did to me. And that's why it's such a traumatic experience because I've never been sexually assaulted before, and I'm not saying it's the same thing as being sexually assaulted, but uh, it feels like something was taken from me that I'll never be able to get back, and it's something that they knowingly did, and it could have been prevented, and they knowingly destroyed my vision for monetary gain, and there is, again, the parallel between that and sexual assault is, maybe stretching it a little bit, but I believe that I was raped of my eyesight by these people. So, symptoms of PTSD may include the following. First one is re-experiencing the trauma. This can manifest as flashbacks, nightmares, or intrusive thoughts about the event. I had nightmares about this procedure almost every night for the first few years, and not just the procedure, but just living with these vision issues and having these vision issues and just nightmares about that and remembering what it was like to see normally and what my life was like before that. So many dreams. I still have dreams about the surgery and what it's done to me. And I mean, intrusive thoughts, I guess you can kind of say I have that because I mean, I'm constantly thinking about these issues since they're present 24/7. The second symptom is avoidance. So individuals may avoid reminders of the trauma, including places, people, or activities that trigger memories. Um, Again, I'm kind of, as far as memories, I mean, I'm always, again, reminded of the event because of just having to see the world in such a distorted way because of the surgery. But I would say I get triggered quite a bit by people such as these ophthalmologists, these eye surgeons that perform these procedures. And when I see them advertising advertisements, they trigger me. People, ignorant people who've had them, who basically try to promote these procedures, is also very triggering. So I try to avoid having to look at that stuff. Although, let's say I'm on YouTube or Instagram, I'll get ads all the time for LASIK or some type of refractive eye surgery, and can't really avoid it. I just report them. So I try to avoid stuff like that. The third symptom is negative changes in mood and cognition. This can include feelings of hopelessness, difficulty experiencing positive emotions, or distorted beliefs about oneself or others. Obviously, I do feel very hopeless, and it's hard to experience positive emotions. As far as distorted beliefs about oneself or others, I guess I could kind of say that the belief of myself is a little distorted because I was actually going to make a video soon about the depersonalization like symptoms that I experience due to having such distorted vision. So I almost feel like I'm not really even experiencing things through my own body, and I'm kind of like a third party observer, like an outside observer, lots of times to my life because of these vision issues. So I don't know if that really classifies or qualifies as to what they're talking about, but that's kind of if you can consider that like a distorted belief about oneself, then I guess that would be it. Last symptom is increased arousal. So symptoms may involve heightened anxiety, irritability, difficulty sleeping, or being easily startled. Definitely more irritable, definitely more anxious, and my insomnia seemed to get worse around when I started having these vision issues. So I'd say, yeah, pretty much developed all that stuff. So I would say I probably do have PTSD from this. And as far as treatment, they say PTSD can significantly affect a person's daily life, relationships, and overall well being. Treatment options include therapy, such as cognitive behavioral therapy, exposure therapy, and medication to help manage symptoms. Early intervention and support are crucial for recovery. So, I don't know if you've seen my one of my prior videos about behavioral therapy and how I'm not a big fan of it. I've tried that with some cognitive behavioral therapy and found that to be of little help. So, um, not really a big fan of it. I don't know what exposure therapy is. I have not looked that up. And as far as medication, I do take anti-anxiety medication, but I'm trying to get off of it. And I made a video about my Xanax use, which now I've been on for many years, and then with about a year ago switched to Valium and have been trying to slowly taper off that because having these issues increases my anxiety by like tenfold. So medication helps, but also it's not something I want to be on the rest of my life, and honestly hate being on it. So really trying my hardest to taper off of it. Never in a million years would I have thought that getting an elective surgery that on paper should have made my life maybe a tiny bit easier would have actually been so horrific and horrible as to give me PTSD. I cannot say enough bad things about these procedures. I know I'm certainly not the only one who's suffered PTSD due to getting refractive eye surgery. The pain and suffering people experience due to these surgeries is just horrible, and it can be so bad that there are many people who have taken their own lives because they can't deal with the complications due to these surgeries. These procedures, they're really no joke, and they need to be stopped. So if you have had the surgery and are experiencing symptoms like this, please feel free to share. If you have PTSD for other reasons and would like to share, I'd be happy to hear that. It's tough to deal with, but you know, at the end of the day, it is what it is, and life goes on, and we have to try to do the best that we can with whatever's happened to us and try to move past it and move forward. So thank you for watching the video. Until next time, stay strong, warriors.